Dyskinesia refers to a category of movement disorders that are characterized by involuntary muscle movements, including movements similar to tics or chorea, and diminished voluntary movements. Dyskinesia can be anything from a slight tremor of the hands to an uncontrollable movement of the upper body or lower extremities. Discoordination can also occur internally, especially with the respiratory muscles, and it often goes unrecognized. Dyskinesia is a symptom of several medical disorders that are distinguished by their underlying cause. Types: acute dystonia is a cerebral type of palsy. Levodopa-induced dyskinesia is evident in patients with Parkinson's disease who have been on levodopa for prolonged periods of time. LID commonly first appears in the foot, on the most affected side of the body. There are three main types that can be classified on the basis of their course and clinical presentation following an oral dose of LA-DOPA, off-period dystonia correlated to the akinesia that occurs before the full effect of LA-DOPA sets in, when the plasma levels of LA-DOPA are low. In general, it occurs as painful spasms in the foot. Patients respond to LA-DOPA therapy. Diphasic dyskinesia occurs when plasma LDOPA levels are rising or falling. This form occurs primarily in the lower limbs and is usually dystonic or ballistic and will not respond to LA-DOPA dosage reductions. Peak dose dyskinesia the most common form of levodopa-induced dyskinesia. It correlates with the plateau LA-DOPA plasma level. This type usually involves the upper limbs more, is choreic, and less disabling. Patients will respond to LA-DOPA reduction but may be accompanied by deterioration of Parkinsonism. Peak-dose LDOPA-induced dyskinesia has recently been suggested to be associated with cortical dysregulation of dopamine signaling. Chronic tardive, late-onset dyskinesia, also known as tardive dyskinesia, occurs after treatment with an antipsychotic drug such as haloperidol or amoxicillin. The symptoms include tremors and writhing movements of the body and limbs, and abnormal movements in the face, mouth, and tongue including involuntary lip smacking, repetitive pouting of the lips, and tongue protrusions. Rabbit syndrome is another type of chronic dyskinesia, while rofacial dyskinesia may be related to persistent replication of herpes simplex virus type 1. Non-motor, two other types are primary ciliary dyskinesia and biliary dyskinesia are caused by specific kinds of ineffective movement of the body, and are not movement disorders. Spastic thrusting of hip area can occur in sodomitopic Parkinson's. See also. References. Works cited: David Healy. Psychiatric Drugs Explained. Elsevier Health Sciences. ISBN A978-0-7020-2997-4. Retrieved December 16, 2010 A.